And today we have two very special guests with us here to talk about prediabetes. It's a lesser discussed diabetes condition, but it affects millions and millions of Americans. So with us we have Rachel Rogers. She's a diabetes educator at North Kansas City Hospital. And Andy Inzerillo, who has tackled prediabetes head on. We're going to hear his family history. His father, what did you say,
96.
96 years old. So how we can all live a long life. Rachel, we're going to start though with you. Explain to us what prediabetes is.
So prediabetes actually affects about 86 million Americans, and it's when your blood sugar is slightly elevated more than normal, but it's not quite that of type 2 diabetes. So when your blood sugar is elevated, it means your body is not processing sugar correctly.
Okay, so what are some of the risk factors for prediabetes?
Well, the most common that we hear about is having a family member with diabetes or prediabetes. That could be a parent or a sibling, but there are some lifestyle factors that really play a role in the development of prediabetes or type 2 diabetes. Some of these are being overweight or having a large waist size, poor diet, so lots of sugary drinks, red meat, lack of activity or too little activity. If you're exercising less than 3 times a week, that can really raise your risk. And then, of course, the one that affects us the most during the holidays is lack of sleep and stress.
Yeah, that affects us every day here. All right, Andy, let's talk, because you have a family history of this, but you're really thriving. So tell us your story, and then tell us how you're dealing with this day to day.
Well, my mother passed away at the age of 73 with type 2 diabetes, and my brother passed away, older brother passed away at 61 with type 2 diabetes. During the time, he lost eyesight in one eye and lost a toe during his lifetime. And my dad has just been diagnosed with type 2 diabetes. And Dr. Campobello has him on a small form of metformin. I myself have been diagnosed as pre-diabetes in 2017 during a yearly physical.
Okay. So how are you dealing with that? What are you doing on a daily basis to make a difference?
Well, one of my inspirations is my dad. He gets up every morning at 3 o'clock, goes to the gym, he walks 40 minutes on the treadmill, hand weights, then he'll go home and rest a little bit. And on Mondays, he'll go volunteer at North Kansas City Hospital for 4 hours a day and works at IRS 5 days a week, 4 hours a day.
Fantastic.
He's just an inspiration.
You're following in his footsteps? I hope you're not getting up at 3 a.m. though.
No, it's a tough act to follow. No, I'm a little more. I get up at 5:30. I'll do some stretching, hand weights for about 45 minutes, and then I'll get on the treadmill for 2.5 and 3 miles. On the weekends, I'll go to the YMCA down in North Kansas City, run the track, lift some weights, and end up in the pool with swimming.
Well, like I told you in the commercial break, you look healthy as a horse.
Well, thank you very much.
Rachel, any more added advice that you'd give to folks?
Well, we do have some tips that we pass along to our patients. The biggest one is finding some habits that you can change. Quick fixes, crash diets really don't help prevent.
Because they don't stick.
They don't stick. You're going to revert to your old habits. Finding an activity that you enjoy that gets you moving. So I don't like running. While I try to do cardio in my life, I enjoy yoga. So that's what I do.
Perfect.
So finding
or dancing.
Or dancing, Zumba.
Whatever, yeah.
That's a big craze right now.
Whatever is your thing.
Yep, exactly. So finding something that you will do. Also, following up with your physician on a regular basis can really help you set goals and find out where you're at. It also allows you time to ask questions. You know, what am I doing right? What do I need to work on?
Also reduce stress.
Reduce stress and mindful eating. So paying attention to how much you're eating. One tip we have is don't watch TV while you're eating, because then you can overeat very easily.
You need a whole bag of chips in 1.5 hour show.
And I actually brought these really fun spoons that I found online recently.
Okay.
They are portion size, and it's hidden on the bottom here, so not everybody needs to know that you're watching your portions.
Perfect.
And they're really fun, so you can. I'm using them for Thanksgiving.
Awesome.
So that I don't overeat, which I always do.
Gravy goes in that one.
That's
all right,
true.
to learn about prevention and treatment options, you can visit nkch.org/diabetes. Thank you both so much for being here. Have a happy Thanksgiving and a healthy, healthy New Year. All right, Michelle, we'll send it over to you.